Good afternoon.
Hi, everyone. Good afternoon. Thank you for joining us today for our first Healthcare Science and Research Career Community Day of the week. And so we are so lucky to have Shawntae join us today to lead this meetup entitled Beyond the Hospital, Exploring Careers in Home Health and Pediatric Care. And so I'm just going to let her have the floor. But before I let her have the floor, we're going to show her how we show up for these events. And so if you are able to, please turn on your camera. We love seeing your faces, and we want to show Shawntae that we're engaged and we're professional. And so please do that if you are able to. And Shawntae, you have the floor.
Thank you so much. Welcome, everybody. I am so grateful that you guys took some time out of your busy day to come and join this presentation. We're going to be talking about pediatric home health. And what that is an option that we don't really hear a lot about. Most people go into nursing thinking that they have to go work at a facility, whether that is long-term care, hospital. So this is titled Beyond the Hospital and Exploring Careers in Pediatric Home Health. So what we're going to talk about is what exactly is home health nursing? What does the role of that nurse look like? What kind of disorders do we encounter? What kind of skills makes or breaks a home health nurse? And what are the challenges and the rewards? What does that look like? So, first of all, I felt it was important to really define what pediatric home health nursing looks like. It is helping children live safely at home instead of prolonged hospitalization or institutionalization. Because some of these children that have significant illnesses or complex disorders, sometimes their family's just not equipped to take care of them in their home. And so many times these children are forced to be admitted to a long-term facility or a specialized facility. It involves providing skilled nursing care in their home, and that could be an acute, chronic, or complex medical condition. But it also means supporting the family, and that individualized centered care that we learn as a nurse in school, it actually goes outside of just being that holistic patient centered care, and it's family centered. So we're going to talk a little bit more about that, and that could really impact that care and what it looks like differently. One of the other biggest thing is we're promoting the quality of life and independence. We want that child to fully function to whatever their highest capability looks like. It could very well mean that their life expectancy is only 5 years old. We want to push it to make sure they get to five or even exceed that five. We have three children that have made it into their 20s that they were not supposed to live past being a child. So that is all because of good quality nursing in their home. Because let's be honest, we know what the hospital looks like. We know what long-term care looks like right now. They don't get the quality of that one-on-one love and care. Why is pediatric home care important? Well, first of all, it reduces hospital stays. If you have a quality skilled nurse one-on-one at home, you're going to still have to go to the hospital occasionally because let's be honest, there's still some things we can't do in the home, but it could get them in and out a lot quicker. It decreases their exposures to the germs and a lot of inadequacies that might happen when that care is now fragmented. It improves child comfort in a familiar environment. If any of us have been around children, or even us, sometimes when we go into the emergency room, we are not comfortable. Sometimes we're forced to have care in a waiting room. Sometimes we're forced to be in a stretcher in a hallway. So that is all scary to a child or a disabled person that just does not understand what all of that looks like. It also encourages family involvement. It takes the nurse and the family, and they are walking alongside each other and they are doing this together. It also reduces healthcare costs. If any of you know what a hospitalization cost or a communicable disease or a healthcare transmitted infection, it is extremely expensive. So if we can keep those hospitalizations or even those medical procedures down in cost, it spreads that cost savings out enormously. It also supports long-term condition management because we have a nurse that's there that's able to be a point of contact and help take that burden off of the families. And let's be honest, families don't always know what the language is. Our medical jargon, our communication, there's so much that can be lost in transit. And I also want to speak to this. It's also extremely helpful. I have a couple of families that are culturally different and they don't understand what our healthcare system looks like. And so, one of the things I try to do is if I can find a nurse that speaks the same language or shares the same culture, it is a huge advocate because some of these families just don't understand, and that language barrier can be a huge problem. So this is just a little chart that I put together and wanted to share with you. It literally breaks down the hospital care versus what does it look like in the home. So the first thing is patient ratios. I don't know how far you guys are in your nursing career, but I'm from the med surge world, and it is very common for me to have anywhere from 5 to 7 patients at a time when I'm working on a med surge unit. And even your critical care units can sometimes be anywhere from 2 to 3. In a pediatric home health home, you have one-on-one dedicated care. And these are medically complex children that many times are ICU level care, but you will only have one client at a time. Work paced. Work pace, working in the hospital or even a long-term care, you are, from the moment you get on to the moment you leave, you are working nonstop. You are getting lots of steps in there. There's a lot of alarms. You're having to multitask sometimes. Potty breaks and lunch breaks are few and far between. When you are working in a home, it is focused and intentional. You're giving all of your attention to one patient. Clinical skills. Depending on where you are working, your acute care skills are going to vary, whether it's you know a lot about one thing or it's your generalized having to know a little about a lot of different things. That's how med surg works. I know a lot or a little about a lot of different tasks versus your ER, your ICU, your CCU. They know a lot about a few different skill sets. With pediatric home health nursing, you are going to have advanced pediatric skills focusing on more G-tube care, ventilators, tracheostomies, those kind of things. And you're going to get to know that one patient and be a clinical expert on that one patient. No child is the same. And that's one of the things that you're going to learn. You take care of one child, you're going to need a different orientation for a second child. Some of those skill sets are going to carry on, but a lot of these rare genetic problems, every child is completely different. How does that team and autonomy? You have a large team that's present for collaboration, but lots of times that team is fragmented. Everybody takes a piece. You have a greater independence in the home and you get one-on-one support from our clinical supervisors. There is a team that might not be in the home with you, but you have a team supporting you from an office that cares about you and wants to succeed. And then you also have that family that's in the home. And a lot of our families actually have become the clinical expert. They've had to learn to care for these children and do these same skills you are, but they've had to learn to do it on their own. Work environment. You have a hospital setting or facility setting with higher infection exposure. In the home environment, it is focused on that family-centered care and it is, you know, surrounded by cartoons or music or play items. It's just night and day different. Schedule flexibility. You often have fixed 12-hour shifts with rotating weekends and holidays in a hospital, and those are not a lot of flexible hours. With pediatric home health, you have flexible scheduling. You get to choose the shift that you want to work. You get to choose the family. You get to choose the hours. Now, I will say that some of our families are very concrete on what they need, and so it just may not be a match for your schedule. But there is a lot of families that they just want respite help. And so if somebody's available 9 a.m. to 2 p.m. one Saturday a month, they would greatly take that shift versus having to do that on their own. Some of our families don't get date nights out. So I have some nurses that they're like, I'm available one one evening a month. Do you have a family that would like to go out for a movie or something? And so there's all that kind of flexibility. And we're always getting referrals. And so even if we have a conversation about what you're looking for, we might not have something that fits what you're looking for right that moment. But as I have referrals coming in, I have all of these nurses and what they're kind of looking for that I'm constantly thinking about so we can match the right client with the right nurse. Impact on patients. During a hospitalization or facility, you're focused on the problem. You're stabilizing that patient and then you're getting them out. And let's be honest, insurances need you to get them in and get them out pretty quickly. We're helping children to thrive at home and we want to prevent them from having to be in that situation. So we are keeping them stable. We are not focused on stabilizing them and just moving on to the next one. So what does the role of the pediatric home health nurse look like? I wanted to make sure I brought some of the common conditions that you might encounter as a home health nurse. So a lot of providers don't even know what would qualify for a home health. Everybody knows if you have a trach or event that they would qualify. But there's a lot of other diagnoses that could get a nurse in the home for 20 or 40 hours a week. If they're born prematurely and they're on oxygen, a lot of times we can get a baby approved and give that new family some support maybe overnight so they can sleep. Because let's be honest, a NICU baby coming home, they have their nights and days mixed up from being on the hospital and they woke up every 3 to 4 hours. So lots of times we can get a NICU baby that's pretty stable, but maybe needs oxygen support or maybe had a cardiac abnormality. So that's, and who doesn't love coming home with a baby and working overnight and just feeding them a bottle, right? And snuggling. And that's an easy staff that most nurses would love to come on. Congenital disorders, whether it's a rare genetic defect or it's a heart abnormality they were born with. Neurological conditions, seizures, cerebral palsy. If they have a seizure and they have seizure medication that they're getting, that is an easy way to get a family private duty nursing support. Cerebral palsy, a lot of other neurological conditions will get a child qualified. Cardiac conditions are another thing that lots of times if they need to have heart surgery, a lot of those children qualify, especially as they're going through cardiac rehab. I already mentioned about the genetic conditions, post-surgical recovery needs. We have some child abuse cases. We have children that have falls and have TBI needs. And so when they have shunts put in, a lot of times they will have post-surgical needs or hip surgeries or even spinal surgeries. Lots of post-surgical. We could qualify for even just in a year getting that family support to walk along. And then, of course, respiratory conditions. A lot of our respiratory failures and needs for trachs, they will all qualify for private duty nursing. So those are the things as a nurse going into the home, you will expect to familiarize with a lot of those diagnoses. So this is another view of just the common pediatric disorders that you will encounter. I'll leave that a moment just so you can kind of take a peek at it. But what I also wanted to do was show you the less common and rare pediatric disorders. There is many times that we're getting referrals And let me tell you, I've never heard of this diagnosis before. So I go get my textbook out and I am researching it. I'm like, what does this mean? And I'm looking at the anatomy and figuring it out because I'm telling you, so many children are coming in with rare genetic things that honestly, a lot of those disorders that we talked about, those are symptoms of a bigger genetical defect. And then you have to learn, how does that genetic defect affect the systems in other areas? So anyway, I just thought that would be something nice for you guys to see. What kind of medical equipment do we use in the home? So we have feeding tubes, whether it's G tubes, GJ tubes, NG tubes, trachs, vents, oxygen, suction equipment, and then IV therapy and central lines. I wasn't sure how far along everybody would be, so I also wanted to actually show you guys a picture of what this looks like because I'm not sure how much touching you guys get with this kind of equipment. So in the lower left, this is a GJ tube or a G tube, and it shows you where it actually is within the body. And then the top right is the actual apparatus of what goes in. And then the bottom is an actual NG tube, which we don't have NG tubes quite as much unless honestly a child is coming home on hospice or a NICU baby if they just need that replacement. But honestly, it's more of the G tubes or the GJ tubes that we are seeing. And then here's a tracheostomy. A tracheostomy is used to help with breathing. And so, usually, if you have an intubated patient in the hospital, they can only be intubated for so long before they are required to have a tracheostomy, and that's to help prevent long-term infections. So, a lot of our children that come home with a tracheostomy, many of them, they will outgrow it. Some of our children will have one for as long as they live. But a lot of people get scared from tracheostomies. And honestly, I try to just tell my nurses when they come in and they're scared of trachs, I say, just think of it as a tube, just like your Foley catheter or your G tube. The only thing is it's helping them to breathe. You know, it's just another hole in their body, another stoma that we're working with. So, with different precautions. And here's our ventilator. So, a home ventilator does look different than one you will see in the hospital. There's a picture of a portable ventilator. Some of our children are on ventilators all the time. Some of them are only needed while they sleep, especially as a child, like in the top right. This would be a child that we're working to getting decannulated. So they may only need it during nap times. And the goal is to potentially get them to not need the ventilator and to only have the trach and then potentially get the trach removed. And then I also added at the top here just how a ventilator functions, how it works, what's the process. Because again, this can be really scary to a new nurse that hasn't touched it a lot. Does anybody have any questions so far? I know I'm kind of moving a little fast, but if anybody has something that they would like to ask, please don't hesitate. Okay, I'm going to keep going then. So, almost all of our homes have oxygen in them, and I always like to tell everybody, we hear the same oxygen warnings and safety assessments as we do in a facility, but it looks completely different in the home. Because let's be honest, they might have this big tank that you see, and they might roll it under the couch, or they might stuff it in a closet, and they might have candles burning everywhere. And so it is so important for when you are a PDN nurse in the home to constantly educate the families on the safety of oxygen because it looks so much different than in a hospital. I mean, there's not the storage that you might have. There's not, the safety protocols that are in place. So anyway, suction equipment. So this is a picture of inline suctioning, and that's the top. That's where you have, it's just part of the trach. But then at the bottom is a picture of just intermittent using a regular French tip catheter in order to suction as needed. So that is a very frequent equipment need that you encounter in the home. And last but not least is IV therapy. So our most common that we would encounter is either a port, which is the top right corner, that's an implanted port, that a lot of our children with chemo end up having those put in. And then you will see a Broviac or a central line, and it could be a single lumen, a double lumen, and that's your top left corner. And then the bottom right is a PICC line. I don't have a lot of children that come home with PICC line. They usually have one of the top two. But I do have a client currently in the bottom left, that's a femoral artery line. So I currently have a teenager that has short gut syndrome that has TPN at home and has a femoral artery line. So that just shows that's a ICU level case that family is having to take care of at home. So I always tell everybody, if you are interested in critical care and you can't get into the critical care units at the hospital, home health is definitely something to keep in mind because almost all of our kids are critical care level kids. So, key nursing skills needed, good assessment skills. It's extremely important for you to have strong, concrete assessment skills. Clinical decision making skills. That doesn't mean that you're afraid to ask questions because I would much rather have a nurse call and ask us versus trying to think through it and make a decision on their own independently if they're unsure. Cultural competence. This is huge in the families because we take care of families of all different nationalities, different cultures. It's You have to have an open mind when you're going into the home because this is their home. We're a guest in their home. Critical thinking. One of the things that I think as a new nurse, it hits you as you're getting closer to graduate. That being that skill of critical thinking, it just kind of pops when you're getting close to taking NCLEX. That is huge. Being able to think outside of the box and troubleshoot from point A to point B. Time management. Time management is huge in homes. And just your education skills. And what I mean by that is your ability to educate the families. Because one of the biggest parts of home health is being the clinical expert and being able to talk to them and teach them if they're doing something wrong. Some families are great and they are the clinical expert. But then we have a lot of other families that this is all new to them and they're learning and they need that nursing expert to walk alongside with them and help teach them as well. Family-centered care, treating families as partners. This is huge. It is never going to work if a nurse walks into the home saying, I'm the nurse and I'm the boss, because this is their home. This is their child. And we have to walk alongside them together. Teaching caregivers medical skills. They might not know how to do the skill, but I am a strong component and no one knows their child like them. They are able to watch and see the warning signs. They are able to just tell you that gut feeling something's not right. Supporting emotional needs. A lot of these children are terminal, and that is huge. They don't know what the grieving process looks like, especially with a family that maybe is coming home with a newborn from the NICU. They've spent 6 months in the NICU and they were expecting to come home with a normal baby. And this looks all different. There is an emotional need that comes along with that you have to kind of juggle that along with your clinical skills to just be that emotional support with them as well. Or if that family is coming home on hospice, it's hard. It's a hard transition. Respecting families' culture and preferences. There is so many times where I get calls from our field nurses. I really want to do it this way, but they're wanting me to do it this way. And I always say, what's wrong with doing it the way they want? Let's talk through that. That's part of that critical thinking, okay? If they want you to wash your hands 3 times before we do this, what's wrong with washing their hands 3 times? You know, if they want to do the dressing change in the crib instead of on the kitchen table, what's the problem with that? Okay. Just talking through. Not every battle is a hill to die on in the home. And so we have to make sure we are doing the care correctly, clinically, but also remembering that we're in a family's home and it's going to look different than in a facility. Encouraging caregiver confidence. A lot of times they might look at you and say, am I doing this right? Do I need to do things differently? And so just making sure to give that positive reinforcement to the family as well as you would like. Safety in the home is huge. So as an agency, I always go out and see the home before I ever send a nurse. I feel that if I wouldn't go myself or want my supervisors, I would never want one of my nurses to go in. So that is huge. What I'm looking for is the infection control, medication safety, is the equipment functioning, safe sleeping environments, emergency preparedness. These are all things that I look at, but any point of me bringing on a case and a nurse coming into work, those things can change. So that's also part of your daily charting. You're looking at all of these things. Is all of this still good? Has something changed? Infection control. We have some homes that they are gorgeous. They're phenomenal. They've got nannies or they've got housekeepers. And then we've got other 1-bedroom apartments that sometimes some of the areas have cockroach infections. So we have to look at what does infection control look like all the way around. I've worked with social workers before to get either bigger accommodations or get fumigators out there, because again, that is the family didn't ask for a complex child and they may be doing the best they can with where they're at this moment. So how can we walk alongside and support them? I have uh, 2 children that live on a farm, and so they have spiders sometimes. Sometimes there's snakes outside, sometimes there's mice. So, there's all different kinds of things that you have to look at that you might not necessarily have to deal with in the hospital setting. Responsibilities of the nurse. That comprehensive patient assessment, looking at the medical equipment, making sure the medical equipment's working, educating, administering medication, care coordination with physician and therapist, communication, continuing education requirements, documenting and care planning. What are the rewards? I am telling you, there is nothing better. And you could go and look at our Facebook page. We have a couple of videos of some kids that they've hit some milestones and their families are so excited. They wouldn't be able to do that if they didn't have a strong in-home nursing support. There is nothing more gratifying than having a child come to us as a baby with a trach and then us being able to discharge them at 3 years and they're a normal child. There is nothing better than a child coming to us with a death sentence, and guess what? They make it to 23. There is nothing that makes being a nurse more gratifying than those. So seeing those wins, having that individualized care one-on-one, it is huge. One of the things that has struggled with me as a nurse, I've been a nurse for 20 years, is not being able to do that one-on-one nursing care like I could when I started. I'm having to nurse a computer instead of a patient. You don't have that problem. You literally get to play with a child. You get to go to the park with a child. Some of our nurses go to school with a child. It's night and day. You're getting to keep a child at home instead of having to go to a facility. The professional satisfaction is just amazing. And then here are just some other little blurbs that some of our nurses have told us. You can forget that 12,000 step shift and heavy lifting common in hospital units. Most of your shift is spent sitting beside in a cozy home environment, providing calm and focused care. In the home, you're the entire team. You are trusted to use your full clinical toolbox from ventilator management to real-time emergency decision. You don't have a charge nurse looking over your shoulder. Hold on, I'm trying to move this. Stepping into a family's home allows you to witness their unique traditions, upbringing, and daily routines. This helps you tailor care plans more effectively than you ever could in a sterile clinical setting. We had a family that was of a Korean descent, and one of our nurses was able to walk through the whole funeral process with that family, which is completely different than we're used to. And I can't tell you how excited that nurse was to come back and say, I was able to be part of this amazing time with this family. Spending Christmas or birthdays with different religious beliefs or cultural traditions. I mean, it's just something you can't get sitting in a hospital or even a facility. Beyond medical care, your presence gives parents the gifts of being parents again. This is something huge that I hear time and time again from parents. When they have a stable clinical team, they're not having to be that clinical expert. They're actually able to be Johnny's mom or Annie's mom, even if it's just for 6 hours while they have a nurse. They don't have to worry about that big clinical piece. By taking over complex medical tasks, you allow them to step back from being full-time caregivers and just enjoy quality time with their child. Another nurse said you're not confined to a hospital room. You can accompany your patient to school, parks, or community events and have a sense of normalcy despite their medical needs. Many high acuity pediatric patients requiring care for 5 years or more offer a long level of long-term job stability and routine that is rare in the high turnover environment of acute care. So what are the challenges? So here's the challenges of being a pediatric home health nurse. So you're working independently. I will say I like to talk a little bit about this since my audience is new nurses. Sometimes people would not think that being in a home health routine would be a good fit for a new nurse. I actually disagree now that I've been in this role. I feel like we do our new nurse training just as good as a lot of the facilities because I've walked through the shoes. Sometimes you're given just a couple of weeks and then you're shoved out, whether you can do it or not. And they say that you can call, but let's just be honest, sometimes when you do call, you nurses eat their young. I've lived it and it's hard sometimes. We do onboarding just like we do with any other nurses, but then we have modules that we do, and then we give you multiple orientation shifts in a home before we would send you out. Sometimes my new nurses have gotten 2 months of orientation in a home before I have sent them out to be 100% independent. And then even after that, you have your clinical supervisor at a phone, and if there's a problem with a medical question. I had just 2 weeks ago, I had my supervisor went out to meet my one of my nurses in the home because they were a newer nurse and they had questions about their assessment. They felt like something wasn't right and they just weren't sure. And so my ADON went out, met her, did her own assessment. They ended up going ahead and sending that client out, and it ended up being that labs were off, did not need an inpatient stay. They were able to do some IV therapy, send her home. And all of that was because of that good communication and good assessment skills from the nurse, but also asking the why. But I always like to say that's a good example of how we support our nurses and our families in the home. You're never alone. And we're always on call 24/7. So if something like that happens in the middle of the night, one of us could also come out and do that in the middle of the night if need be, or jump on a virtual call. Emotional stress. So this is the biggest piece that I always like to say is taking care of a child that's sick and passes. It's hard. It is really hard. And A lot of times that's going to be the outcome going in. And there's nothing that can prepare you for the loss of a child. And that is definitely one of the things that I always say it's not meant for everyone. Communication and collaboration. Home office staff, pediatricians and other providers, respiratory therapist, PT, OT, speech therapist, and play therapist, hospice team, case managers, and social workers. So on a given day, we communicate with all of these different people. A lot of these therapists, they come out weekly. So a lot of times the nurse is there being able to help with the play therapy, help with the PT therapy, help to continue learning those therapies that these professionals are giving to these families and helping to stabilize them throughout the next week and meet future goals. So what are the takeaways? Being a pediatric home health nurse, they provide specialized care in the home, and we support both children and their families. You need strong clinical and communication skills, and you play a critical role in improving those outcomes. And you build strong relationships with the children and families while supporting their long-term goals. So I wanted to kind of talk through a couple of questions with you guys. First of all, what skill do you think would be the most important in pediatric home care? I want some answers. I've been doing all the
Yeah.
talking.
Feel free to unmute yourself, students. Maybe, Shawntae did a great presentation and I love the examples you gave. And so feel free to unmute yourself or type in the chat. What skills do you think are important?
I'll kick it off.
Perfect.
Oh, Brandy said listening skills.
That's great.
Oh, Nadia said communication talk for them to understand. Yes,
Mhm.
yes.
That is great, Nadia, because let's think about this. If they don't understand, and I don't know if any of you speak Spanish, but two of our families speak Spanish. And so there is lots of times they may say they understand, but they don't really understand. And so if you don't have someone that speaks that language or even that same clinical jargon, right? They might say they understand, but they really don't. And so getting that teach back and getting that confirmation is huge because what good is it if they're only doing a skill 8 hours while you're there? If they're going 16 hours more when there's no nurse present, that's not beneficial to anyone. So that's really good.
Patient.
Rua said patience. Yeah.
Yeah.
Oh, yes, patience is huge because let's just be honest. Families can be difficult and children can be difficult, especially if they're not feeling well.
Yeah.
And then Shrija said empathy and compassion. And then another student said organization.
Yes, yes, absolutely. That's great. All great answers. So I asked this or I set a few challenges during the presentation. Think about what would give you a challenge if you were to go into a patient's home right now? What would be the most challenging thing? I talked about bugs, I talked about rodents, I talked about the different cultures. Um, think about temperatures. I don't do well if I'm in a really hot home and somebody doesn't want to put their air on. Think about that. So think about what would make you the most uncomfortable if you went into work into a patient's home.
maybe for me, I'll start off. Oh, Brandy said a family member that challenged my expertise a lot. Ooh.
Mm-hmm. Yep. How would you navigate that?
Listening skills. Number two, maybe process a theme behind what's going on. What's really going on behind them challenging me? Because it could be grief, it could be fear, it could be frustration. So maybe validating some feelings, and I'm a counselor, I have an education in counseling, so that's me coming out. But at the end of the day, it's to make sure that you can make a connection, and then maybe that faith and those feelings and all the things can be more regulated so that you can, let's call it, co-facilitate the care versus feeling like they're persecuting you every time you make a decision about their child.
Absolutely. And one of the biggest things that I have seen with home health is sometimes you remind them of somebody they have a
Mm,
poor past experience
mm,
with. And so I always try to get down to the why. Why are you feeling this way? Validating those feelings because maybe it is that you talk like someone or you look like someone. And maybe it has nothing to do with you specifically. It's that past trigger. Sometimes I haven't done a really good job at explaining the why I'm doing something because lots of times they just need to know the big picture. And I'm actually like that. If someone tells me I need to do something a certain way, sometimes I might get a little taken off because I might not know the importance. I'm like, if the outcome's going to be the same, why does it matter? Sometimes just doing a little bit better education wise. Sometimes I need to actually get pretty technical. One of our families is a engineer and the mom is a calculus instructor. So
mm.
guess what? I have to talk in a different way with her than I do with even the dad, or even I have a pulmonologist that is a dad of one of my clients. So I always tell my nurses, if you want to learn a trach vent case, I'm going to send you to that home where the dad is a pulmonologist because you've got a live-in clinical expert and you're going to get the best training from that live-in pulmonologist. But knowing your audience and explaining. So great, Brandy. Great. Jessica, what were you were saying
Oh,
something.
I was gonna say for me, sometimes I feel like every home has a particular smell, and I'm a very sensitive smell person. So I think that might take some time getting used to. And also, like, smell is very tied to like memories and things like that. And the other way around too. I might smell a particular way to some people when I go visit their homes, and that might trigger something as well. So I think like overall what you're sh saying, Shantae, is being a pediatric home health nurse is you're utilizing like almost all your skills all the time.
Hmm.
And it's really getting to understand the family and being on a very mutual level of understanding and communication. And you're always using those analytical, critical thinking skills.
Absolutely, absolutely. And I had mentioned about the temperature. That's the biggest thing with me is if I am hot, I cannot focus on anything else. And so that would kind of be a deal breaker for me,
Mm.
is if I'm going and I'm physically miserable, it doesn't matter how good of a nurse and how great of a schedule it is. That's just not going to be a good fit for me. And I'm a chatty Cathy. I talk loud, I talk all the time. If a family needs a serene nurse that's calm and chill, it's also nothing about my abilities. I'm not gonna, relationship wise, I'm gonna be too much for that family, and that's okay too. Does
And
anybody
in
else?
that
Oh,
And
go
in
ahead.
that situation, Shantae, would you find a nurse that fit that family better?
Hmm.
Okay.
Yes, yes. And that's part of how that conversation goes. When I am usually one of my clinical team members does our interviews, and then we bring them into the office to do the onboarding once they've completed the onboarding links. And usually we'll meet them and we will talk. I always ask the question when I'm doing an interview, describe to me what your perfect client looks like, right?
Mm.
I'm not going to be able to get that to you right off the bat, but it is huge for me to be able to know what does your perfect schedule look like? Do you have a perfect age? Do you have a perfect, uh, you know, disorder? Is there
Mm.
something you're really passionate about? I have some nurses that are just they're great cardiac baby nurses. They are completely experts in that. So I know if I get a cardiac baby referral, I have a team of nurses that I'm like, these are the nurses I'm going to call first because I know they love cardiac babies. Not that they're not good nurses and other things, but I also have two families that it is extremely sensory that triggers their children's behaviors. So I know that if I interview a nurse that meets me with my energy, it doesn't matter. I'm not even going to talk to them about that case because I know that that child is going to react negatively because of just their personality. And it's not a negative thing. It's just, unfortunately, I have learned what triggers some of our kids and what does not. Does that make sense?
Yes, thank you.
No, absolutely. Has anybody else answered about challenges?
Maybe some of the students don't know until they get there.
Well, I get it. I get it. I get it. That's perfectly fine. What about how can you support families while caring for these type of children? So I know, Brandy, you mentioned already you've got the counseling background, which is huge. Think about ways that you could show those families support while they were going through this extremely difficult time in their life. What are ways that you could support them?
You asking me?
Oh, wait,
Everyone,
there's
everyone.
Okay.
a Rasmus said keeping a strong line of communication between the family and the nurse.
Absolutely. Absolutely. Somebody earlier said listening and patience,
Mm-hmm.
right?
Mm-hmm.
So those are strong skills, but I think wouldn't that be really a really good way to support them? Because if you're a good listener, they might not say something, but to you, but maybe you hear a phone call, maybe you hear them venting to their mom. And there might be something you hear or pick up on that you could let your case manager know. And then you know what? We could reach out to the hospice support. Let me tell you, the family didn't come to us about cockroaches. And they were so embarrassed. They hated
Mm.
that. They lived in an apartment building. There was nothing they were doing that caused these cockroaches. But it took that nurse picking up on that, reaching out to us, and then we helped advocate for bigger things in order to get that taken care of at a larger level. So those are huge ways that you can help those families because a lot of times they're really struggling with the situation they're in.
Mm.
Well, Jessica, we're about at time, right?
Yes, we are.
Oh,
Oh yeah, you had so much information, Shantae, and I loved all the real life examples you gave us and the engaging questions you asked. Shantae has been grateful enough to provide her phone number, her email address, and her LinkedIn. So please, please connect with her. She's also shared these slides with me already. So all the attendees, I will send you the slides. We will also post this recording onto our YouTube channel so you can rewatch this, send this out to your friends if you wanted to. Thank you all students for asking these questions. And let's just really thank Shantae for being here with us and providing all this great information. Thank you, Shantae, and thank you,
absolutely.
students, for joining us today. So have a great day, everyone, and please make sure you check our website for all the rest of the events this week.
Hello.
Um, oh, yes?
Yeah. You can help me copy the link in the chat box, please.
Oh,
Yep,
Tuan
I
asked
will.
if you could.
Yeah.
Okay,
I
great.
absolutely will. I
All
will.
right.
Yeah, thank you so much.
Do you want my link